Hey guys, today we are going to start looking at some pathologies. We're going to look at diseases of red blood cells, diseases of blood clotting, diseases of white blood cells, and diseases of bone marrow cells. Um, I've taken a lot out of this section. We're just going to go over some of the more common ones, the things that we've heard of a little bit more, and pull up. We're going to pull out, not worry about the ones that get a little more specific. Like, for example, anemia. Anemia is a deficiency in erythrocytes or hemoglobin. So if we think of anemia, we think of iron levels, which um, hemoglobin is what carries iron and oxygen in your blood. So a deficiency in that is anemia. There are 5 different types of anemia that the book talks about, but we're not going to get into all that. We're just going to talk about anemia and that being a deficiency in erythrocytes. Okay. Diseases of blood clotting. We've all probably heard of hemophilia or someone being a hemophiliac. Okay. Um, Hemo meaning blood, as we know, philia meaning love or attraction to. So it's excessive bleeding. Um, because uh, you you don't have the right clotting factors. Okay, those clotting factors are needed to make the blood to help the blood to clot, so it gets stickier and it stops bleeding. So a lack of that means you just continue to bleed and bleed and bleed. Another disease of blood clotting is purpura. It's actually kind of more of a not necessarily a disease, but more of a term that talks about symptoms. Okay. But it's multiple little hemorrhages or accumulation of blood under the skin. You can see in this picture, um, there's just lots of little um, kind of not clots, but little spots of blood under the skin. Petechia are tiny purple or red flat spots appearing on the skin as a result of hemorrhages. I've never been able to find a good picture of petechia. Um, Braxton had an instance where he had a bunch of petechia, and even I took pictures of him, and you just can't, it just doesn't show up well in a picture. Um, but you can see there's some, with my cursor here, there's some little red spots. These are some of them too, but you can see the little red dots. Um, those are just like little pinpoint hemorrhage spots. Okay, they're flat. They're not raised at all. They almost look like kind of like moles. I mean, obviously, there's a lot more, and they suddenly appear, but that's kind of what they look like, and they're really small and tiny and flat like that. The next term, and again, it's not really a disease or anything, but it's a term that talks about kind of a symptom. So, echomosis are larger blue or purplish patches. They're also known as bruises. Okay, you can see on this person, they have multiple bruises, large patches of kind of reddish, purplish, bluish um, spots on the skin. Autoimmune thrombocytopenic purpura. Okay. So if you take that, it looks really intimidating. You take it and you break it down. We have auto meaning self, immune meaning immune, thrombo, clotting cell or platelet, cyto meaning cell, penic meaning pertaining to a deficiency, and then purpura meaning those tiny spots of hemorrhaging. Okay. Um, and it's autoimmune disorder. So it's a condition where the body starts to make antibodies against itself. Okay. Those antibodies are against the platelets. It's been a few years ago when you seniors were freshmen. Braxton had this for a very short time. Very, very scary very scary time for us. Um, but he had been sick. He'd had, something that seemed like the flu. And then a couple of days later, had been horsing around the wrestling room. That's what we do. And um, had been horsing around with Eli. I'd been throwing him around and things. And the next day, I started noticing he had bruises on his legs. And he's a wild 2-year-old child, so they have bruises on their legs. Didn't think much about it. As the day went on, he had more and more and more bruises. He started getting them on his arms. I lifted up his shirt, and you could see little petechia all over his shirt, or all over his belly, all over his back, all over his upper legs. He had them just everywhere, and it just looked like little pinpoint bruises. This was, I think, maybe a Saturday night, Friday night. Um, so we um, debated all weekend long. I contacted friends in nursing, and I researched, which I know you shouldn't do Google research. Use Google, Dr. Google. Not a good idea, but I did. And I terrified myself. Okay. I was absolutely convinced that he had some major blood issue going on. And so we took him to the doctor on Monday, went back and forth trying to decide whether we should take him into the ER, and ultimately waited till Monday. Um, Monday, they did a ton of blood work and found that his platelets were I can't remember the numbers now. I'd have to look it up, but extremely, extremely low. Okay. Um, which confirmed my suspicions that something major was going on. I thought that possibly he had leukemia. Just terrifying, terrifying couple of days. Um, anyway, did more blood work, sent him to Riley, found out that he just had ATP, which essentially his body had that virus, and then his body, the virus closely resembled platelets, and so then his body made those antibodies against that virus, but saw the platelets and thought the platelets were also the virus. So his body just started destroying the platelets, just like crazy, destroying them. Um, but it was an awful time. Luckily, he is okay. As you all know, he's a maniac. Um, but it was a very, very traumatic time, and you can it was interesting to see because, like I said, you can't find a picture that really depicts it. And I wish I had the pictures of the petechia on him because it was very interesting. Nothing like anything I've ever seen before. Then we're going to move on to diseases of white blood cells. And the one we're going to talk about is leukemia. We've all probably known someone, been affected by someone that has leukemia, but it's just an increase in cancerous white blood cells. Remission, that's a term we've all probably heard a million times, but it's when you have a disease and those symptoms go away. They go away for maybe a short time, maybe a long time, but those symptoms go away. Then, when they start to reappear and you need further treatment, that's what we call relapse. Um, Another blood pathology, mononucleosis. Um, of course, we've all heard of this one, mono, okay? But it's an infectious disease, obviously very, very infectious, very contagious. They spread easily. And what we notice here is that their leukocytes are increased and our lymph nodes are swollen. Okay. Some symptoms, I don't probably have to tell you guys this because you've probably all either had mono or known someone that's had mono. But fever, extreme fatigue, asthenia, which is weakness, or pharyngitis, which is inflammation of the pharynx, which you lose your voice. Okay. Spread by oral contact. Obviously, you guys know that it's called the kissing disease. Um, And that's about all we're going to talk about with mono. The very last one, a disease of bone marrow cells, is multiple myeloma. Okay. If we look at myeloma, it is tumor or mass of the bone marrow. Okay, so there's just a malignant, which means cancerous, neoplasm of bone marrow. And remember that neoplasm, neo means new, plasm means formation. So it's a new formation. Okay, you can see that in the um, vertebrae here. That's all we're going to do for today. Um, Please let me know if you're having issues or questions about any of this. We're going to look at these terms. You guys are going to look at these terms a little bit more closely over the next couple of days. Um, you've probably seen by now, but I'm going to put out the rest of the week today. And there is some stuff for you to do today with this video and things. And then tomorrow you're going to do kind of like a little presentation. Um, and Tuesday as well. Okay, it's not going to be super hard. Don't stress out about it. But I'm going to give you those 2 days to work on that. Okay. Don't forget to check in on Tuesday with the word of the week. But other than that, if you have your presentation done, that's all you have for Tuesday. Okay. Let me know if you have questions. Have a fabulous weekend. I won't be putting out any more videos between now and next Wednesday. So have a great weekend. Please, please don't hesitate to contact me if you have any questions throughout the weekend.